Hi, everybody. Welcome to the Scaling Community of Practice and the Mainstreaming Initiative working group. My name is Richard Cole. I'm one of the co-directors of the Community of Practice Mainstreaming Initiative. And let me just tell you a few things about it before we get going with our case study today. This Mainstreaming Initiative is something that the community started in early 2023, and it's a 2-year action research initiative focusing on mainstreaming scaling in international development funder organizations. We have mostly focused on funders, but we had a few other cases, CARE being one of them, which does a tiny bit of funding, but is mostly an implementing organization. The purpose of the mainstreaming initiative is that we felt that there has been a lot of talk about scaling, but people really wanted to know to what extent how to integrate scaling into their organizations. And so the mainstreaming initiative was precisely that, looking at how organizations, particularly but not exclusively funders, have integrated scaling into their operational modalities. We looked at several things. First of all, to what they've done, or well, what was driving their integration of scaling? Why did they think mainstreaming scaling into their activities was important, and how did that happen? What were the factors that drove that? What did they try to do, and what did they make progress in to date? Some things they were successful in, some things still face challenges. What they've learned about that experience, both for their own purposes, but also for other organizations that were interested in integrating scaling. And last but not least, why we're here today, to disseminate those lessons to other organizations that are interested in mainstreaming scaling. As I mentioned, the initiative primarily focused on funders, despite the fact that we did have two fantastic international NGOs, one of them being CARE. And we chose organizations based largely on their willingness to collaborate with us, as well as the fact that they had made at least some progress in mainstreaming scaling. So obviously, this is not a random sample. The particular questions that we looked at, as I mentioned, yeah, I've gone over that. So I'm really delighted to welcome CARE today. CARE, I actually have a personal disclosure. I've been coaching CARE for about 3 years. CARE has, in my mind, been one of the cutting edge organizations, certainly among NGOs, large NGOs, in integrating scaling into their work. About 3 years ago, and I'm sure Anita will tell you more, started to launch a new division on innovation and scaling, and created a small team internally that Anita, who we're delighted to have with us, along with the rest of the team, has been leading. And since that time, they have been working through a variety of modalities to integrate scaling into their various projects and innovation packages. And with that, I'll hand it over to Anita. You're muted.
Gabby, if you could advance to the agenda slide, I'm not actually able to see the slides. Oh. All right, so my name is Anita Kella, as Richard said, and I'm the Director of Impact at Scale at CARE. And today I'm going to be telling you just a little bit about sort of the broad brushstrokes of the process of mainstreaming scaling at CARE and what that's looked like. But then we've brought in a bunch of colleagues, both from CARE and from our most essential partner institutions, to help share that are going to tell you a bit about the actual hard work that it's taken to go beyond having scaling in the vision and strategy, but to actually operationalize it in practice. Next slide. A little bit about CARE. We're a development and humanitarian organization focused on ending global poverty. CARE will be 80 years old next year, and we work in 100+ countries around the world. And our focal areas are gender equality, the right to health, climate justice, the right to food and clean water, and economic development. And we work in emergency contexts, development contexts, and at their nexus. Next slide, please. There is a lot of detail in our case study, which is online for the mainstreaming initiative. And so I'm going to focus on a higher level overview. And then, like I said, my colleagues will tell you more about the real work that's happening to mainstream the mindsets, principles, and practices of scale into an organization like CARE. So CARE had always been great at identifying impactful interventions, adapting them for new contexts, and then replicating them. But the process of routinely thinking beyond CARE's own footprint really started coming into focus in 2015. And it was in that year that CARE's 2015 to 2025 year strategy defined impact growth strategies that were focused on direct delivery, replication, and systems level change to deepen impact. And this was sort of a formal recognition of the importance of thinking beyond the project level in order to maximize impact, which was something that our teams had long acted on, but this was the moment in which it was sort of more formally recognized. Village savings and loans associations were a model that had originated with CARE and had subsequently been replicated in many contexts by many actors. And in 2018, in developing their scaling strategy, the VSLA team focused significantly on scaling through governments as part of social protection programming and other actors, which had proven to be an important way to reach more people more quickly and with greater impact than through direct delivery alone. In 2019, based on the VSLA experience and others like it from that 2015 to 2020 strategy period, CARE's board and executive leadership formally recognized how important a focus on scaling was to achieving impact goals and maximizing return on development dollars invested. So in 2020, impact at scale was included as a foundational element in both the organization's Vision 2030 and in its 2020 to 2025 strategy. So this was a notable moment in the mainstreaming of scaling at CARE, as it required that all programmatic country and regional teams integrate scale into their own strategies and plans now that impact at scale was seen as a foundational element of strategy. So after that, in 2021, CARE's work on defining and designing scaling efforts intensified. A review of impact data from the prior strategy period helped CARE identify 6 pathways to impact at scale, which were published in a publicly available impact at scale guidance note, and I'll return to that in a moment. Also, this was when a cross-CARE working group developed a formal definition of scale, which you can see on the slide here, and defined sustainable scale as being achieved by scaling through governments, market-based approaches, or open ecosystems. The organization also established globally scaled as a key strategic pillar of work, setting up a steering committee of senior executives from CARE's program, regional, and strategy divisions to develop organization level scaling goals and track progress towards those goals. So this is really the timeline of how CARE integrated scaling into its vision and strategy. And in subsequent slides, I'll tell you a bit about how that vision and strategy has been operationalized. And of course, my colleagues will go much deeper. Next slide. But first, I'll tell you a bit about our approach to scaled impact. As I said, a review of our most impactful programming from the 2014 to 2020 strategy period revealed 6 pathways to impact at scale. And those were scaling and adapting proven models, advocacy, social norms change, system strengthening, supporting social movements, and inclusive market-based systems. And each of these was seen to contribute to a different aspect of what's required to scale impact. So scaling up, we defined as when you influence local and global actors to pass laws and policies that foster supportive enabling environments for scalable solutions. Scaling deep is when you shift the underlying patterns of belief and behavior that cause inequality and injustice through social norms approaches and working with social movements. Scaling out is when we support government, private sector, and CSOs to adopt, pay for, and implement scalable solutions. And this is how we reach exponentially more people than CARE can through its own footprint. And if you could advance. We've subsequently, through our work since 2021, thought a bit more about these pathways and their relationship to scaled impact. This graph is very much conceptual. It's not mathematical. Please take it as such. And we think about the fact that direct delivery, yields constant impact. And that's when a solution is developed and implemented in situ by CARE. Replication is when care and partners replicate things that worked elsewhere, adapting them for a new context, and that yields linear scale. Systems level impact, which is related to scaling up and scaling deep, is when we strengthen systems in enabling environments, we shift social norms, we influence policy, and we support social movements. And this leads to accelerated scale. And finally, there's catalytic impact, which derives from scaling out. And this is when other doers and pairs at scale sustainably scale solutions. So we think of governments, private sector, civil society organizations, and this is what really leads to that exponential scale. Next slide, please. All right, so once scale was enshrined in the vision and strategy, we had to figure out how to operationalize it. And broadly framed, these are our goals: to scale our most promising interventions through other doers and pairs at scale, to serve as a platform for scaling the sector's most powerful solutions, regardless of origin, and probably most importantly, to become an organization that designs for scale from the start. So the teams that were built around sort of this imperative have evolved over the years. So in 2019, our Impact Learning, Knowledge, and Accountability team was formed. And the original intent was for this team to build and execute a process for scaling, but there wasn't a dedicated person on the team focused on scale, and it had all of CARE's evidence needs to take care of. So the scale focus didn't really advance. But ILCA does continue to work on scale by developing and honing methods for measuring scaled impact. And you're going to hear from Caitlin in a bit, who will tell you a bit more about that. Impact at scale, in 2020, CARE created as Richard alluded to, created an impact and innovation division, and within it created a dedicated team focused on impact at scale. We're a small team, and so we relied heavily on some great partners. We've worked for the last few years to develop evidence-based processes for assessing which legacy interventions have the potential for sustainable scale and for adapting them to be more scalable. And that's work that we've done in deep collaboration with our evidence partner, IDinsight, who you'll hear from also. We've also started thinking about what it takes to actually scale an intervention through local actors. How do you identify which actors in a given context can be the doers and pairs at scale? And then how do you engage with them and support them to scale those interventions? And we've worked on this area very closely with our systems integration partner, Geneva Global. You'll also hear from them in a recorded presentation here shortly. In 2023, CARE created the Program Design and Thought Leadership Team. One of their objectives is to work with technical teams on designing CARE's next generation of programming based on the evidence of what works and designed to scale from the start where that's appropriate. And you'll be hearing from Emily, who will tell you a bit more about that. Next slide, please. All right, so some of the activities and challenges, and here I'm focusing on the work of the Impact at Scale team in particular, what we've done and the challenges we've encountered. And I'm just going to dive deep on a couple of these in the interest of time. So one thing that we've focused on a lot is developing methods and processes to try to learn what makes an intervention sustainably scalable, how to analyze a solution to gauge how impactful and scalable it is, and all of that is to make sure that we're scaling the right things. And hopefully through that process, we can learn about what it takes to design for scale from the start. What's been hard about this is a couple of things. Number one, there was no handbook about how to do this work. You know, we were using IDIA's 6-stage process as a framework, but those 6 stages don't actually tell you what to do. And so we've had to sort of wrangle that ourselves. And we've been really fortunate to work with great coaches like Richard, who helped us understand the mindset and principles of scaling, and who've been really great thought partners as we were initially developing and iterating those methods. Another challenge we faced was that we knew that everything we did needed to be grounded in robust, if not rigorous evidence, but that wasn't an expertise that we had on my tiny team. And we were fortunate to build a learning partnership with IDinsight, and they've been able to really bring that lens and that expertise to our work. Another arena that we've worked on is assessing the scalability of legacy interventions. CARE has a lot of very successful interventions that have had impact, that donors are excited about, and that they're eager to fund. And these are interventions that have been developed, implemented, and iterated with a lot of care. What's been hard here is that the presumption was that such interventions naturally had the potential for scale, I guess. But not everyone was thinking of scale as sustainable scale, which is other doers and payers adopting, implementing, and paying for them. And to many, replicating an intervention through CARE's footprint using grant funding was what they thought was scale. And so our sustainable scale standard really did create some consternation, because for sustainable scale, an intervention needs to be simple, affordable, and cost-effective enough that, say, a government in the global south can pay for it. And most grant-funded programming that is trying to solve deeply complex challenges is not simple, affordable, and cost-effective. So I'll confess that there were times when it felt like we were the scaling police, and that wasn't pleasant. Next slide. All right, so a few of the high-level lessons learned. One thing we've learned is that there are no shortcuts. The literature says that sustainably scaling an intervention takes 17 years. And we definitely disappointed an organization that may have expected us to figure out how to regularly scale solutions in 2 to 3 years. Figuring out how to do the work has taken us a lot of time. Achieving the mindset shift in a large decentralized organization takes time, and we're in it right now. And then changing the systems and structures and processes to sort of lead towards scaling, that also takes time. But we've learned a lot that we're proud of, and you'll hear more about that from my colleagues. Second lesson is that there will be trade-offs. When you design or redesign something to be leaner and to make it more scalable, chances are that you're going to have to give up some of the impact generated. But this is where that cost-effective really comes into play, like the impact that you're generating per dollar spent, because ultimately, if you've got a really impactful and powerful intervention, but it would cost the government 5 times more than the annual budget of the responsible ministry to adopt and implement it, there's going to be no impact at all. And so what that puts upon us the responsibility of designing interventions with the resources of the doer and payer at scale in mind. The third lesson I would share is that internal buy-in is critical. Everyone at CARE agreed that achieving scaled impact was an urgent priority, but not everybody agreed on what that meant and how to do it. And I would say that there's still not full buy-in to the idea of sustainable scale. Some teams still consider replication to be scale. And what we're working on now is embedding the methods and processes that we've developed into the business as usual of CARE program teams. Because ultimately, it's that integration, not having a standalone department of scaling police, that is likely to coalesce the organization around an understanding of scale that we can then all work towards together. That's what I've got, and I'm excited now to pass to my colleague, Will Thompson from IDinsight.
Will, if you could introduce yourself a little bit more, that would be great, rather than my doing so, please.
Okay. Anita, thanks for the lead-in and introduction. Hi, everybody. My name is Will Thompson. I'm an economist and associate director at IDinsight. I've been at IDinsight for about 6 years. My training is as an agricultural economist and impact evaluator. But during my time at IDinsight, I've had the opportunity to really expand the sectors that I work in and the kind of tools that I use and evidence I generate in the service of clients. Also work quite a bit on qualitative work, sample surveys, process evaluations, things of this sort. For those of you that might not be familiar with IDinsight, we're a global data and analytics firm. We work with stakeholders across the social sector, so of all kinds, governments, NGOs, foundations, development banks. And our purpose, our reason for being, is to use rigorous data and evidence to help those stakeholders maximize their social impact. We use a variety of tools. I think we're very well known for doing impact evaluations, but we use a variety of tools, as I said, qualitative work, process evaluation. The emphasis is really on matching the correct tool and activity to a stakeholder's evidence needs. And we prefer to work in this kind of arrangement like we have with CARE, which is what we call a learning partnership. So as they arise, looking at these kind of discrete decisions and tailoring evidence to fit the needs of the client. Our particular engagement with CARE is a 3-year partnership funded by the Ty and Ray Norda Foundation. We are supporting Anita's team directly by providing a full suite of decision services with the goal of helping develop these sustainably scalable models. So far, we've worked on 2 interventions. The first is a gender-based violence prevention program that we determined based on evidence is probably not a great candidate for sustainable scaling, that it should be replicated where the conditions are right for it. But again, probably not a great candidate for this sustainable exponential model. And I'll get into the reasons why for that momentarily and how we used the available data and evidence to arrive at that recommendation. And then the second is currently ongoing and in the beginning stages, but it does look like we're going to graduate this to kind of further stages of sustainable scaling. And this is a market-based sanitation program where CARE will partner with ID International Development Enterprises to develop MBS solutions that should be replicable and scalable in a wide variety of contexts. So repeating a couple of things that Anita mentioned about what we feel. So I'm going to talk about assessing potential for sustainable scale. And again, we say that an intervention, or we believe that an intervention has potential for sustainable scale if it meets a few criteria. The first that Anita didn't mention, and I guess it should go without saying, is impactfulness. So we are first looking for evidence of rigorous impact for an unscaled pilot version of a program. We're then checking it for simplicity, affordability, cost effectiveness. So simplicity, I would say relatively simple. You know, some level of complexity is fine and is to be expected when you're trying to tackle complex, multifaceted problems. Where it becomes problematic is when the complexity makes a program too difficult to replicate, too costly, too many moving parts that can break, questionable whether inputs or activities are available. You know, in these global South contexts where we plan to work. So looking for simplicity and also looking for affordability and or cost effectiveness. So affordability, because even if cost effective, a program that's too costly might be prohibitive for doers and payers at scale in the global South. So this is something else that we're looking at, critically looking at the evidence to try to establish. Yeah, so I think what doesn't have potential for impact, I've kind of covered: questionable at scale, questionable impact, too complicated to replicate, too expensive to attract partners, even if cost effective. The kind of evidence that we're looking at. So as I said, I'm an economist. IDinsight is well known as impact evaluators. We love quantitative evidence. Quantitative evidence, I think at this stage, is often it's very scarce. It's very costly to generate. It's sometimes not reliable or relevant. So at least at this stage where we're assessing sustainable scale potential, we're relying a lot more on qualitative inputs, on desk research. Well, first looking at availability, conducting desk research to dive a bit deeper, and relying a lot on experts, on key informant interviews and stakeholder interactions. We wrote down a few. So the challenge, I'll just draw your attention to it. We're trying to understand which impactful interventions have the potential to succeed at scale based on best available evidence. The opportunity we see is to develop a systematic framework for applying evidence through the scaling pipeline. I'm going to show you the scaling pipeline. It's the 6 stages that Anita mentioned. We have started to map activities and tools to each of those stages, something that we can kind of systematically follow for each intervention and assess the suitability. We see the solution as using existing evidence as much as possible, generating new evidence as required at each of these stages. And these are my lessons learned. These are definitely my opinions. Anita's might be different. My colleague Rico is on the line. His opinions might be different. But to me, the key lessons learned so far are that if sustainability is the goal, sustainable scalability is the goal, designing for that and building in data and evidence tools from the beginning is desirable. Identifying potential scaling partners ahead of time and designing with them in mind is also desirable. And I feel like this is the approach that we're trying to take with ID on this market-based sanitation program. and that not all interventions are right for sustainable scale, and that is really okay. I think the ones that are suitable for exponential scaling are rare. They're special. They're likely to, only work in situations that it's a tall order to meet these 3 criteria that we laid out. That doesn't mean that an impactful program isn't appropriate for linear scale and should be replicated where and as the conditions permit. Okay, so I'll advance to the next slide. These are the 6 stages that Anita mentioned: ideation, R&D, proof of concept, transition to scale, scaling, and sustainable scale. As I mentioned, we've started to map activities and tools to each of these. And I should also say that this is not as linear as it looks. Ideation and R&D tend to happen at the same time. Proof of concept and transition tend to happen kind of simultaneously. At each of these, at the end, there's an opportunity to, as we say, pause, pivot, or proceed. So this is less linear, more iterative than this suggests. But just to give you an idea of what kind of activities we're using, at the ideation stage, deep evidence review and theory of change analysis. So evidence review, we're looking at academic papers, we're looking at white papers, looking at working papers, looking at existing reviews that have been done by project teams, existing evidence reviews. We are looking at whatever cost data is available to get a sense of cost effectiveness. We're doing this for particular interventions and perhaps for the entire sector to get a sense of what works and how a candidate intervention fits into the big picture. Based on this, we're going ahead and starting to develop theory of change. If there's already a theory of change, that's great. A lot of times at this stage, we develop one that's more granular and really start to think about how a theory of change for a pilot intervention is likely to change at scale. What kind of assumptions are likely to, what activities and inputs might not hold, what assumptions might be required going forward, because this informs further stages. At this stage, we're using lit reviews, cost effectiveness reviews, a lot of key informed interviews and workshops. As we move into R&D, we are adopting, we're completing some different activities. Here we're starting to think a lot about enabling environment, competitive landscapes, and what that scaled theory of change looks like. Again, this leans a lot on desk research, KIIs, stakeholder workshops. But the key question that we're asking, I think, with respect to enabling environment is, for an intervention that we want to consider for sustainable scale, what are the enabling environment requirements and how likely are they to exist in contexts into which we would want to expand or scale? Is it reasonable to think that there's an enabling environment? If there's not an enabling environment, can it be developed? If it can't be developed, how reasonable it is to change the program to meet the conditions that do exist? Questions like that. Competitive landscape is related to enabling environment, but I think a bit distinct. Competitive landscape, we're really looking at who else is doing this. Are they doing it as well or better or more cost effectively? Is that a reason not to enter a market, or is there something that we can learn from peers or competitors in a particular sector? And we're more fully developing this scaled theory of change. So thinking about when we blow up a pilot theory of change and expand it, how do the inputs change, how the activities change, what additional assumptions are required, what assumptions that hold for a pilot are not likely to be met when we expand. So once we've moved into proof of concept, we are pinpointing some of these key changes that we expect to see between pilot and scaled versions, thinking about, so these are opportunities, pain points, both, and we're thinking about designing short trials and kind of rapid research methods around testing these. And then as we transition to scale, hopefully there's some proof of concept. This is a point where it is appropriate to collect more quantitative data and to use monitoring data and impact evaluation data to assess how the scaled program, potentially scalable program, is faring. Okay, like I said, we've done this twice. We've been through one full exercise. The first was this gender-based violence intervention that we found to be an impactful program, but very difficult to scale. So as I say, very promising IPv prevention program. We considered it as a candidate with mixed evidence and replicability concerns. So we did 4 activities. The first was one of these deep evidence reviews. So for this, there were a couple of academic papers, several academic papers around it, actually. One for the original implementation, one for an attempted and an effort at a scale up. We also looked at evidence reviews, and we conducted lots of KIIs, stakeholder workshops. What we found is that in the context where it was implemented, this GPVO program was undeniably impactful. It reduced gender-based violence and had a lot of other secondary positive outcomes. We also found that it was extremely complex. There were 4 sets of activities, kind of these interlocking pillars. All of them had very specific input and activity requirements. And we started to get the sense that if any of those were tried to simplify them, we might sacrifice impact or even invite backlash. And the second set of academic papers established that there might be some backlash when we tried to kind of simplify. So that was something that we noted at the evidence review stage, that we further unpacked when we did theory of change analysis. So constructed a comprehensive TOC, invited the experts, the designers of the program to comment on it. Really got the overwhelming feedback that efforts to simplify these 4 pillars would reduce impactfulness, probably make it less impactful, again, possibly even invite some backlash at the community level. Theory of change analysis seemed to confirm and verify that. We also looked at some adaptations. So this particular program, there had been some efforts at adaptation within care and outside of care. It turns out that very few of these were actually faithful to the original design, and the evidence of whether they're impactful was really mixed. So we didn't have much. So from the adaptations review, didn't have conclusive reasons to to take it forward. And then the final activity that we did was this competitive landscape review, where we took a sample, a purposive representative sample of several impactful interventions in the IPV space, and looked at those and found that kind of operating in the same pace was with different models. There were simpler programs that were achieving similar desirable impacts with a bit less potential for backlash. So the output of all this, on the basis of our analysis, was that this is a great program, definitely appropriate for linear scale, but the scope for reducing the size, the potential for getting it wrong, the risk for getting it wrong if scope were reduced, limited its prospects of sustainable scalability. Second case we're working on now, and I'll speed up a little bit. I think I'm running slightly over time. This one, we're doing similar activities. So this is the scaling partnership with ID. We've conducted a full sector evidence review of the WASH sector. We looked at market-based sanitation and community-led total sanitation, found great opportunities to scale, potential to scale MBS. It's not straightforward to scale MBS. There are definitely some complexities, but the sense within the team is that those complexities can be met by a scaling partnership that leverages CARE's comparative advantages and ID's comparative advantages. So just really quickly, MBS tends to work on supply side, demand side enabling environment. IDA is great at supply side. They are great at human-centered design. They're great at market segmentation. CARE, we think, is excellent at demand side. There's an opportunity to leverage VSLAs like deep care networks and to really work together to implement market-based sanitation in a way that overcomes the potential barriers to impact at scale. Review past partnerships that have happened between the two organizations and are using that to inform our path forward. We've looked at the enabling environment and found several places that are good candidates for scaling, and identified one where we will go ahead and try to scale a version of a market-based sanitation intervention using this partnership. And then post that, we will move into hopefully more impact evaluation And that is, yeah, that's our path forward. And happy to take questions later in Q&A. Anita, who am I passing this to?
Yeah, so now I'm delighted to ask Emily Janik, who is CARE's Associate Vice President of Program Design and Thought Leadership, to join, and she's going to tell us a bit about CARE's efforts to figure out how to design for scale from the start. Emily.
All right, thanks. And everyone, let me know if my audio goes weird. I'll turn off my camera. I'm in Ghana today, and the internet is sometimes a little creative. So if I think I might be able to. Looks like I can't advance the slide. So if we can just go to the next one, please. So the big challenge here is thinking about how do we do program design in ways, as Anita says, that really focus on scale and thinking about scale right at the beginning. And it's not just a CARE problem. This is a problem for lots of organizations. I'm at a conference this week that's talking about designing nutrition programming, and somebody said, look, in the whole history of nutrition, we've really only scaled 2 interventions. We've scaled vitamin A distribution, and we've scaled sort of, measuring child weights. We haven't scaled anything else, even though there is tons of evidence about what works and what could work at scale. So CARE is not alone. This is a pretty persistent problem. Inside CARE, we've diagnosed that one of the main challenges is that design is done by us, and therefore we are designing with an implementer mind. We're designing with ourselves as the doer. So what are the resources and the infrastructure and the time and the expertise that we have available to us? And so we're thinking about how do we work within our own systems, and that's how we design our programmings. There's also, again, this is not just CARE, there's a real push to think about what are your quick wins? What is it that you can get done fast? How can you demonstrate that you're working and that you're delivering sometimes as soon as 3 to 6 months into a program? That often means, and there's also a real push to say we should be using approaches that are approaches we know, right? We should be using the ones that have the most solid, best evidence base behind them. And that's great. There's a lot of reasons that those are important. There's a lot of reasons that's the way the incentives are built in the system. But what that turns into is we aren't designing for scale because we're designing for ourselves as the doers. And scale necessarily implies there have to be other doers in the equation, even if we're still part of it. Other people have to be able to pick this up. They're not going to have the same systems and resources we do. There's one example where we did something we piloted that worked incredibly well to say frontline health workers, what they really want is recognition. They don't need a huge bump in their paycheck in this particular set of frontline health workers that we were working with. What they would like is recognition and a little bit of a reward. So they did award ceremonies, and the health workers got pots and rice cookers and some things like that. Then we said, great, that worked incredibly well. We saw performance go up. We're going to turn that over to the government to replicate. The government's procurement systems were so slow and so impenetrable that they could not replicate that because they were operating with an entirely different system. But that means we have to think about those people right from the beginning of design process. And we have to design interventions that think, not does it work in my procurement system? Does it work in the government's procurement system if that is our goal? Not does it work within my HR setup? Does it work within the market HR setup? In a private sector partner, we think could scale this. So we have to do that right at the beginning. And there's some ways that we can think about doing that. One is co-creating with those stakeholders right from the start. Don't wait until you're 5 years into a project where you say, great, we have really good evidence that this works. Now you take it. In the last 6 months of the project, you say, we've developed all these tools and resources. We'll do a handover ceremony. You take it. We actually have to start right at the beginning with those actors to say, what are your constraints? What are you looking for? How are you thinking about that? We also have to think about making designs that are simpler and less complex. And we've just talked a lot about that. Will talked a lot about the evidence of the complexity and what happens when you simplify. But at scale, often scalers have to simplify. And so we have to think about how to streamline. Again, incentives and tools in the development world are often geared towards adding complexity. They're geared toward adding more things in, teasing out more layers of complexity, more underlying causes. That sometimes leads us to develop things that are really quite complex and very difficult to replicate. And then we also have to think about who else is paying for something. What does that funding stream look like? Will talked about market-based systems. I've had conversations with private sector partners where they say, sure, but you're the payer and therefore you're the customer. We're designing for you. We're not designing for the farmer. We're designing for you because you are our customer. And that is how we built our business plan, was for you to be our customer. That's a whole different business plan if you're selling to us versus if you're selling to a farmer at the last mile. So those are the kinds of things that we have a real opportunity to think about. So at CARE, what that means is we've actually hired a series of designers to help us think about that, to help us think about how do we bring in that set of unusual suspects, that set of doers and payers at scale, that set of clients at the beginning, so that if you do bring a private sector partner to the table, they're not talking to us as the client, they're talking to the ultimate client as the client, right? So how do we bring those folks together? How do we also think a much broader range of evidence? One of the things that has been incredibly exciting about this work is that idea to say, look, these are not designed as one research study across 8 different projects and 8 different methods and 5 different countries, whatever it looks like. Very few things are designed that way, but we can still compare evidence across different approaches and say, here's what this evidence says this approach was strong in these ways and weak in those ways. Even if they're not perfectly comparable, you can't just dump all the data into the back end and spit out an answer. You can still start to do that kind of comparison of what does evidence look like more broadly. And how can we be a lot more rigorous comparing evidence, not just to say, did it work, to say, does it work the best of the available options with the resources that could be on the table? So those are the kinds of things that we're thinking about as a team. Next slide, please. So what's different? One of the things that's different is who's in the room. So I talked about designers, right? How do we have somebody whose role is it to say, we're going to try to bring these stakeholders together. We're going to try to do that, do the brainstorm, put lots of things on the table, but then start to streamline, then start to ask yourself these hard questions of, if you could only do one of these, what would it be? Which ones of these is going to make the most impact? If you had to simplify this model, how could you do it? And how do you ensure that that simplification is not going to cause harm later? Because that's possible, right? An example of simplification I was talking about today is that in order to make it easier to do safety standards testing, automobile companies only test on a standard male body. They test seat belts for men, but not for women, because that is a simpler process for them. So they streamlined. I have some objections to streamlining in a way that doesn't test to see if I'm safe in a car. But so there's some ways to think about when do you streamline and when can't you. We also, and I've talked a little bit about this, who are those stakeholders in the room and how are they talking to each other as part of a system and not a bunch of one-off conversations with us? So that if we become the filter through which everything runs, it's going to get really heavy on our perspective. How do we set up some of those conversations where people can speak to each other and we can observe and learn, but we're not biasing the conversation in those ways? And like I said, more different kinds of actors. So thinking about government and private sector, civil society, how are we making sure that we do that? And how do we do that in ways that make the best use of their time and result in more actionable, scalable designs? So one thing that can happen is you bring more people to the table, you end up with more ideas on the table, and you just cram more ideas into your design, that you just try to take a little bit from everybody and you stick it all in, and then you buy yourself sort of an elephant, but maybe part of it's a camel, and then you haven't gotten to something that's going to work. And a lot of these people are incredibly busy people, and we're asking their time, especially if you think about human-centered design, women farmers. Those are the busiest people on the planet. They do not have time to be wasting in huge, long, difficult conversations where we explain a bunch of frameworks to them that aren't really meaningful. So how do you do those processes in ways that take best use of people's time and delivers value to them, and not just sitting through workshops for the sake of being in workshops? This is an example from a USAID project. It wasn't one of CARE's, where they called together a bunch of women in Haiti and said, we're really interested in women's perspective. So we're going to have this workshop about women's perspective on food. And halfway through the workshop, the women just got up and walked out. They just stood up and walked out of the room, and somebody runs after them and said, what happened? And they said, well, you brought us here to consult, but you haven't let us speak. We've been here for hours and you haven't let us say anything. We've been listening to you. We have stuff to do. Bye. We can't do that. We have to come up with ways that make that kind of consultation constructive and helpful for them. Next slide. So how do we do that then? Another thing for us to remember is that design is great. It's incredibly important. It's not enough. What you have on day one of your program is not what will happen through the life of your program. New things are going to come up. It's the Mike Tyson quote, no plan survives everyone has a plan until you get punched in the face, right? Hopefully that's not what's happening, but you will have shocks, you will have changes. So you have to build part of your design to be flexible space, to be space for iteration, to be space for checking in with stakeholders again, to be space for adapting. So if you lock yourself into a 5-year scaling plan without any choices, that's not going to work very well. We also really have to think about evidence, and I talked about that as well. Again, there's evidence you have at your starting point, but you also have to make sure that you're collecting evidence along the way to say, are we on the right direction or are we on the wrong direction? And that has to be light enough touch that you can use it. You can build yourself an evidence system that is so complex you drown yourself in data and then you can't react anymore. So how do you know a handful of really key indicators that can help move you in the right way? And one that I've seen and starting to see more is, how do you value a participant's time as one of the inputs of the programming? So the work that Will was talking about, that was one of the coolest things I saw in there, with saying, here's how much we're asking participants to spend in this approach. Not how much time does it take me, although that is certainly something that I think about, but how much time does it take them? And if it's 5 times more expensive in their hours than a different approach, are they getting 5 times more value out of it? So that's the kind of thing we need to be thinking about. We also have to really look at more than one kind of option. It's pretty rare that there is one option that is the absolute correct option for everyone everywhere. So how do we think about having different kinds of options and then having feedback from different people? So an example I can give is, we had a market systems approach in Bangladesh, and we assumed that the scaler would be the private sector and the private sector would scale all the training approaches. And the first thing that happened was they started scaling the approaches and the training approaches, and the people in the training went from being 30% women to being 7% women once you handed it over to the private sector, because that wasn't important to them. That wasn't one of the metrics that mattered for them. So suddenly you saw, yes, they scaled, but not in the way we intended or not for the people we intended. So then how do you build in that feedback loop? And how do you build in the feedback loop from the women to say, why aren't you going? What's happening here? Right? So you have to kind of build some of those pieces in. And then we really do have to think about the landscape. Part of what's very seductive about the idea of scale is that you can take an idea and it can run all the way around the world. Yes, and it can run around the world, but it's going to have some adaptation. And there are going to be some places where it's not going to work at all. And really having respect for that local context, and for saying, just because it worked somewhere else doesn't mean it worked here. Just because it worked for that group of people doesn't mean it works for this group of people. And thinking about, how do you then shift based on the landscape? So those are all some of the things that we're working on now as part of the new team that we've just constituted, and thinking about both who are the designers who can help facilitate these processes, but especially how are they making sure they have the right people in the room, and how are they building the right feedback loops and flexibility so that we can continue on this journey over time. I think that was the last of my slides. So then that means I hand over to Caitlin.
Actually, we've got Joshua from Geneva Global.
Oh, I'm sorry.
No, that's okay. But it's he wasn't able to join us today, but he did prepare some video remarks for us. So Gabby, I'll let you launch those.
I'm Joshua Muskin. I am a senior director here at Geneva Global and have been accompanying the care team from Atlanta, working on impact scaling and system integration, system orchestration for a couple years now. And it's a joy to be with you, at least virtually today. I'm sorry I'm not here in person. I'm going to be talking to you about 3 aspects of system orchestration. First are, what are its goals and objectives? Second, what are the key domains for which to plan with system orchestration, with drawing on examples from Nepal and Rwanda, and looking at what CARE's role in system orchestration may be. So to start, the mission or the assignment that I was given by CARE was to look at how to move the Farmer Field and Business School in Nepal, or help the team in Rwanda with its village savings and loan associations, how to help them move those programs from a situation where CARE serves as the payer and doer to one in which the host system institutions serve as payer and doer. What does this mean as a goal? It means situating responsibility for the program's sustained and scaled implementation within host system institutions that have direct authority and significant influence for the program's principal domain and any key associated domains. By sustained and scaled, that basically means that when CARE and others who are other outside actors who are funding and operating programs in a country, when they're done, that host country institutions will continue the program and that they will use their resources and mobilize other resources to move it to other parts of the country where it may be relevant and useful. By host system institutions, I'll talk more about this in a moment, but I'm talking about government, civil society, private sector, and other actors within the country who are there permanently and in fact usually have access to more resources than any one international partner. Institutions that have direct authority, these are the ones that are responsible for setting policy, for making plans to implement policy, for allocating resources and spending those resources or managing those resources. These are the ones with direct authority. And then others with significant influence, they may be actors who don't directly affect the program, but still can have a big influence. This can be, unions or parliamentarians, other politicians and the like, who may have, for either good reasons or bad reasons, ways to interfere with or to support an initiative. And by principal domain, when we're talking village savings and loan, we're talking savings and credit. When we're talking farmer, field, and business school, we're talking agricultural productivity and value chains. Associated domains may be domains that CARE has identified or that the host country systems identify as connected to or benefiting from the work with the principal domains. I'll talk a bit more about that in a moment. Strategic objective of system orchestration. We're looking at key stakeholder institutions that have the capacity and commitment to sustain, scale, and evolve the program. If you're handing it off, they should know how to do the program, what to do, and have the resources to do it, and the commitment to follow through. Stakeholders operate structures and strategies that are appropriate to and effective in meeting the programmatic roles and responsibilities for the respective interventions. The core program model is fully adapted and adaptable to prevailing conditions and institutional capabilities. I'll talk more about that in a moment. Structures and strategies exist to operate to ensure coordination and accountability across stakeholder structures. Different host system institutions will have different roles to sustain and scale the intervention. How and who do we is making sure that all of these different elements are operating in a coordinated manner and in alignment. And then finally, other external partners working in the same or similar sectors are also committed to system orchestration. For example, VSLA in Rwanda, CARE is not the only international organization working in this local savings capacity space. Are they also in tune with, committed to supporting system orchestration? If they are not, then quite frankly, CARE's efforts at system orchestration may be in jeopardy because government is looking at two different approaches, and If you're asking government to start assigning its resources to work in an area while it's still receiving resources and support from other partners, what is their motivation for investing seriously in system orchestration? Okay, looking at system orchestration domains, we're starting with the technical domains with VSLA. As I mentioned earlier, financial inclusion, savings and credit is the top tier goal of the initiative, but gender transformation is also critically important to the initiative. Integrated development more broadly, both how do women use their greater access to savings and credit to promote household and community development, and how do initiatives by CARE, by the government, by other actors in the integrated development space, how do these help mothers or help women to strengthen their income so that they can save, get access to credit, and the like. And then civil society engagement, as women are engaged in savings and credit. This could, and in fact does open up many other opportunities for them to take on leadership or at least participant roles in other civil society efforts. Looking at FFBS in Nepal, at the top is agricultural production and market access, but also gender transformation and overall household well-being play very important roles. When we're looking at who's taking on these responsibilities, we need to look across the system levels, not just at the central, but also at regional and local level. If we're only making local efforts, what are central actors, stakeholders, authorities doing to support the systems or the models, systemic scaling and sustainability? If we're looking just at the center, what are we doing at the local level? Who at the local, central, and regional level are we talking about? We're looking, as I mentioned earlier, across all system sectors, be they government actors, civil society, private sector, or even international partners. And these need to be coordinated, as I indicated earlier. They need to work in alignment. And then we're looking at what's enabling success in the technical domains for which each of these different system, sector, and level actors are responsible, whether it be policy setting it or enforcing it, monitoring it, planning and budgeting, partnership and coordination across the different actors. And then we also have functional aspects. What strategies are the different actors undertaking and coordinating to be able to make progress in the technical domains? What training and support is happening? Who's training and supporting the trainers? And then monitoring and evaluation. How are we making sure that progress is being made and that folks are responsible for it? Looking at system orchestration, CARE's role, go through this quickly. CARE is responsible first for validating, demonstrating that the model, whether it be VSLA, FFBS, or whatever, is worthy of scaling and sustaining. They need to pilot the model, improve the model, adapt the model to local context, and generate evidence that will convince the host system actors that yes, indeed, this is worth sustaining and scaling. Advocacy, they need to secure the commitment of key stakeholders, communicate the empirical evidence, show the model in reality to decision makers and others with site visits and the like, present the technical elements so that everyone understands what's involved, and then advocate actively for system orchestration. Buy-in is establishing or identifying existing structures to lead system integration, agreeing on transition strategy from CARE to system stakeholders to implement and fund the program moving forward, setting steps in a timetable for transitioning from CARE to host country system integration, and then mobilizing buy-in from other stakeholder groups, as I mentioned earlier. Creating an enabling environment so that the host system can indeed implement successfully. Securing system capacity and commitment to implement, making sure that it occurs, that the program or model appears in their plan and budget, that they are mobilizing resources for this, that they are engaging different partners, whether they're internal to the systems or external, training and supporting the key actors, administering and managing, that they have capacity and are assigning people to these functions, that they have a system for monitoring and evaluating, and that they have identified and enabled and instructed the folks who will lead the program technically. And then finally, what's necessary to adapt the model to suit local parameters, getting costs to a level where they can be managed by the host country system or host system in general, that the material inputs are accessible and relevant, that logistical assets are that the requirements are ones that the host system can meet, that there are access to the required services, and so on. So I thank you. I've been a little over time. I'm sorry that I'm not there to hear your comments or answer any questions, but I do look forward to a report out from my CARE colleagues and to seeing the recording eventually. Thank you so very much.
All right. And last but not least, I'm going to pass to my colleague, Caitlin Shannon, who is the Director of Research with us at CARE. Caitlin.
Thanks, Anita, and thanks, everyone. Rounding out the conversation on scale, I'm going to talk a little bit about measuring scaled impact. I think as my previous co-presenters have suggested, more and more, the work that CARE is doing and will continue to do is as a catalyst for scale, as opposed to being an implementer directly delivering services. And for this reason, it's really important that we invest in measurement approaches that allow us to document and understand the value add and impact of that work. That is to say, to better understand or to understand at all the difference our scaling efforts are making for the people and communities where we work. There are obvious challenges to this, to measuring scaled impact. And I think predominantly the challenge is defining and measuring the impact of our work that happens indirectly through other actors. Again, when CARE isn't serving as this direct implementer, directly delivering services, what is the impact that we're making? How are we making that impact, and how do we best measure it? The opportunity in this kind of measurement transformation, I think, is really about in transforming how the sector defines and measures impact, which again has traditionally been focused on direct measurement and attribution of actors' work to change, and is limited to the period of direct implementation. So we can think about the impact of CARE scaling work and the work that that was talked about, the systems orchestration work that was shared about. The impact of that can continue on beyond the period where CARE is directly involved. So again, how do we understand that impact that we're making, and how do we measure? The solution really is for us to shift to measuring impact through estimation and inference, and I'll talk a little bit more about that, to leaning into qualitative metrics as relevant and necessary, to focus on assessing contribution as opposed to attribution, and really to measuring impact or change over longer time frames. So we've been working on this effort of transforming how we define and measure impact over the past several years. And some of the key lessons that we've learned, again, I think have already been alluded to, but are certainly directly applicable to measurement, is that this really requires a mindset shift, different organizational capacities, and also collaboration beyond CARE. Next slide, please. So this is how we conceptualize impact in this world where we're significantly investing in sustainable scale. Again, we've evolved and expanded our definition of impact to encompass 3 different kinds of impacts, which are visualized here. Direct impact is that impact for people where care delivers programs directly to participants or group, and that change is a direct result of our work. Systems level impact, as we define it, is the impact for people in communities that is achieved by contributing to systems change. So again, all that work around systems orchestration is one example of how we can and do contribute to systems change. And that again will have a knock-on effect and eventually and hopefully an impact directly for people. Catalytic impact is that impact for people and communities that's achieved by spurring the adoption, replication, and diffusion of a program or approach. So that's sustainable scale. In the case of systems level impact and catalytic impact, care contributes to impact indirectly by influencing other actors. So in this respect, it's really care's role in relation to the impact that occurs that is different. And again, with direct impact, care's role is that it's providing directly service delivery or assistance that's benefiting a group of people or communities. With systems level impact, care's role is really to work with other actors to advance structural changes that in turn improve the lives of people beyond care, beyond the project participants at care. For our care's direct programs. And finally, for catalytic impact, care has no direct role. Really, it's actors beyond care that are adopting and scaling models and solutions that care has invested and helped to establish and promote. And I think finally important to the measurement of these 3 different categories of kinds of impacts is that the data, the methods, and the time frames specifically for measuring systems level impact and catalytic impact are different from those traditionally employed to measure direct impact because of care's role and therefore the pathway to change or impact. We're pretty good at measuring direct impact, but we're getting better as an organization at measuring systems level impact. And I would say that we're still learning how to best measure catalytic impact, as in some respects, that's the most challenging thing to measure, in part because the sector doesn't generally measure this kind of impact. There are not a lot of really good models and experience to build off of or from. Next slide, please. So these are our frameworks for and our methods and approaches that we use to measure systems level impact and catalytic impact at the highest level. I'm not going to go through all the steps. I know the slide deck will be shared, but I want to point out a couple of things that I think are important to understand. Impact measurement, both for systems level impact and catalytic impact, leverages similar steps and approaches, as you can see, including that both rely on a well-constructed theory of change that articulates the pathway for impact or change, and both leverage inferential approaches as opposed to direct measurement to determine impact. This requires leveraging secondary data and ideally external validation to improve the credibility and reliability of estimates, because again, we're leveraging secondary data with inferential measures to model and estimate impact. So again, having that external validation really helps to ensure that what we're reporting in terms of impact is really credible. Unlike systems level impact measurement, catalytic impact measurement requires considerations of probability or certainty. How certain are we that this impact might happen? Because in many instances, we're estimating future impact. So we're projecting into the future from today till 5 years from now. We think the impact of this approach going to scale by this payer and doer is X. And additionally, catalytic impact estimates that are of future impact should definitely be reviewed and revised on a routine basis, again, to improve the precision of those estimates as well as to improve certainty. And ideally, impact measurement in both categories should leverage data on the same indicators. This really allows us to track impact from direct implementation to systems level change to catalytic change of a particular approach or program intervention, like VSLA, or like our farmer field and business school. Diving in a little on our work to pilot and expand catalytic impact measurement for care. This is a particularly interesting and challenging kind of impact to measure. I've alluded to some of the differences between measuring systems level impact and catalytic impact. Both require data on breadth, that is how many people are impacted, and depth, what kind of change is experienced and how big or profound is that change. To date, our efforts to measure catalytic impact have been quantitative in nature. And in the cases that we have been able to credibly estimate catalytic impact, the most critical input into that model was the availability of impact data on the intervention. The lack of availability of data, impact data, makes quantification a key constraint to measurement. Next slide, please. So just to highlight an example where we've been able to measure catalytic impact and see that scale that's really achieved from moving from direct implementation to sustainable scale. So between 2018 to the present, CARE has partnered with the government of Nepal to improve access to government services for marginalized farmers. Dubbed the Farmer ID Card Initiative, this program established a process for farmers to apply for and receive government services. This approach was, again, piloted in 2018, scaled to 4 additional districts through 2022, with support from CARE and implementation. And beginning this year, the government of Nepal will be scaling the program nationally. Our estimate of the catalytic impact of the government of Nepal scaling through 2030 of this initiative is 1.4 million households, which is more than 10 times the impact achieved in the pilot phase of the program implemented by CARE. Our ability to estimate catalytic impact in this case allows us truly to demonstrate the importance and value of CARE's contribution to the effort to improve the livelihoods of marginalized farmers in Nepal through this approach of getting to sustainable scale. Next slide, please. So just thinking about what is this transformation that we need as an organization and arguably as a sector, if we're going to be able to measure the impact that this kind of work is having globally. I want to point out just 3 major things. There's like lots of points underneath those things. I'm not going to dive into them in our presentation, really, just because we don't have time. But the first is that we need to lean into indirect measurement and feel comfortable and confident that that is an appropriate and valid approach to measuring and understanding impact. Second is that we need to adapt measurement to measurement over longer timescales. The sector currently, really prioritizes measuring impact within the context and the time frame and scale of a program. And it's really clear that the effect of this kind of work goes on for years to come and isn't constrained or only measurable in the period of a program that's being implemented and funded by a donor. And finally, we really have to account for multiple actors contributing to change. CARE isn't the only person or entity that's supporting this kind of change and effectuating this kind of impact. There are many stakeholders involved, and we need to acknowledge that and integrate that into how and what we're measuring and how we're reporting it and what kind of conclusions we're making about it. I think the biggest challenge is how we operate, how we manage organizational change to support our ability to do these things. I think, as Anita alluded to in her presentation, transforming measurement for sustainable scale requires not just shifts in systems and operations, but also, and importantly, a mindset shift, and not just at CARE, but across the sector. Hope that's a good conclusion to CARE's presentation, and looking forward to what I assume are many questions. So back over to Anita and Richard, and thank you again.
I'll just thank you all, and I'm going to hand it to Richard.
Thank you, Anita and Caitlin and Emily. This was fabulous. I hope that the audience is not too intimidated, because it's really quite impressive what you've accomplished. I know it started more than 3 years ago, but particularly in the last 3 years, you have really ramped it up. I'd like to pick up on basically where Caitlin ended, because this has been in the chat. A lot of the talk is about, implicitly, was good practice in improving your CARE's practice and scaling. but you all have alluded to the challenges of operationalizing this internally. Could you talk more about that? And maybe in particular, first of all, Anita, you started in your presentation that not all the staff is on board with the defining scaling as replication versus sustainable impact at scale. So how is it to get people to move to that kind of change in mindset? Secondly, we had a lot of discussion about evidence for scale and scaling what's needed, how to collect it, systems change, excellent presentation from IDinsight. How does the staff feel about this much more rigorous and deeper level of evidence? You sort of talked about that, Caitlin, from, well, did the project have impact or not, as opposed to systems level impact, indirect impact, evidence for different stages of scaling. This is a lot. Okay. And last but not least, it's very exciting that you're moving in this direction, but are the donors who fund various care projects moving with you? I'm not familiar with, USAID, for example, saying, yeah, go look at the catalytic 3 or 5 years after the project. They seem to stuck to some extent in, what happened with the money we gave you. So if you could speak to those issues, but particularly the issues of internal organizational implementation, changing mindsets, changing evidence bases, changing practices, because this is a mainstreaming webinar, and I think, basically the question I'd ask you to answer is, there are other organizations on this call who'd like to do this. What would you tell them about, how to, not just what to do, but the internal challenges you're facing, how to do it?
Well, I mean, I have to say that I wish I had a great answer to that, and I don't, and we are very much in the middle of it, right? And I think that there are, different approaches. Like, I know that I've talked to the folks at CRS, and they sort of talked about how they started with the mindset shift. We sort of dove into the very technical because we felt like we didn't know how to do what we were trying to do, but that's had, some, who knows, maybe it set back the mindset shift because of the fact that we were perceived as the scaling police. It's hard to tell. But I think that what we're finding now is that the more teams we have worked with on analyzing these interventions, and the more specific we have been able to get about the methods we use and what they yield, the more teams are starting to understand that there's a value to looking at things this way. And importantly, leadership is starting to understand that it's important to look at things in this very detailed way. They were always on board with scale, but what that precisely means in terms of how programs need to be doing their work, that's part of the mindset shift, right? And so, as I noted at the end of my presentation, we're now in a moment where we are working on embedding this way of looking at things into the normal operations of program teams, country offices, regional offices, et cetera. And really what you need for that is top leadership support, right? Like, that's how you ultimately get it in there. And I see all the work that we've done to date as being the work that was required to operationally figure out what needed to be done to build scaling into the DNA of care, so that we could then convince key leadership, you care about scaling, this is what that actually looks like in this institution. And so these are the things that we have to do. So I think that I'm not like, we had this strategy to change mindsets. We're in the middle of it. So I don't have a better answer than that, I'm afraid. Are the donors there with us? Not really. We try to carve out little bits. A lot of the work that you've heard about, it's been a couple of very forward-thinking smaller donors. Like, we've had sort of very flexible funding from a longtime donor to CARE, a family foundation, that has really supported and encouraged us to figure this out. As long as we were learning, iterating, and advancing, that they wanted to learn, iterate, and advance with us. And as we said, the Ray and Ty Norda Foundation, also Small Family Foundation, has been instrumental in supporting the work with IDinsight. But I think Caitlin can probably tell you more about the extent to which donors are happy to fund looking at things sort of the way that we're trying to look at them.
I mean, just a quick comment on that. I think there is more acknowledgement in the donor community and interest in understanding what how impact is sustained and should change is sustained 3, 5, 10 years. USAID does certainly invest in some sustainability studies. Some donors do fund them, but I would say in the body of evaluation and research that's invested in it, it's a very, very small amount. And I, for me, I think it's a very much a lost opportunity, because we should be investing in things that do result in that sustained impact, that are sustainably scaled. The only way to know that and to learn from that is to invest in that kind of evidence generation. So hopefully, maybe there'll be a pivot in the donor world around that. In the meantime, I think there is ability to kind of leverage bits and bobs of resources here and there to do a few studies now and again within an organization, at least like CARE. I think maybe one of the advantages of the approach that we've taken to measuring catalytic impact is that, again, we can estimate into the future with some assumptions, with, if we're able to access data. And I think that can demonstrate the potential impact that will be, that will happen in the future, and we can continue to try to iterate that. And it's not at tremendous cost if we're able to leverage existing data. It requires a certain amount of resources and a certain amount of expertise and the availability of data. But it is a sort of a more low resource way of trying to at least have an understanding of that, and show that to people like donors. Maybe they'll invest in future studies. So
one thing I should probably be very clear about, that I assume that this is implicit, but it's not. All the work that you heard about today also represented a significant investment over many years of unrestricted resources by CARE itself. Like, this is not the kind of this kind of transformation. You might find a couple of family foundation donors who are willing to and excited to help with certain pieces of it. But, think of all the people that we've discussed that are involved in this work. Like, that has been the institution supporting those departments and those teams to do that work with unrestricted resources. So that, this can't sort of happen in 10% of this person's job, 20% of that person's job, and 5% of this person's job. Like, there has to be a dedicated effort and a dedication of unrestricted resources to doing the work. If you can find the restricted money to do it, then please tell us how.
Well, that's great. Let's bring in Emily here. Emily, if I can pick up with you the same questions I already asked.
Emily had to jump.
Oh,
yes,
she had to
I'm
jump.
sorry.
My bad.
Yeah.
Okay.
Sorry.
So I guess, Anita and Caitlin, in the few minutes we have left, if you were, and if there's another organization, maybe they're not the size of CARE, but, a lot of the people on this chat, I'm sure, work for implementing organizations. You mentioned, CRS started off with trying to change the mindsets, you trying to do the work and then change the mindsets afterwards. I mean, what advice would you give to, another organization? There aren't many people who have your job, Anita, to basically to push this through and make this happen. If you were coaching others, what would you tell them? I know you only have give you 2 or 3 minutes, but what would you, mindsets first, substance first, dialectically going back and forth. I mean, what would you, key leadership was critical, obviously, but if you could expand on that, please.
I think it has to start with that integration to the vision and strategy, so that everybody's taking it seriously, that this is something that people need to focus on, right? But I think that we could have done, I can only base it on my experience, and I would not say that we've done it in the cleanest, best way possible. Like, we've done a lot of trial, error, iteration, fixing, had great partners to help us think about that along the way. And we didn't really, we always knew that it would require mindset shift. And I think that I was always hopeful that the technical merits of the work and how insightful it was going to naturally change mindsets. But that doesn't take into the reality of humans and how they work, and the fact that a lot of these are programs that they put a lot of heart into and are dedicated to and really do want to see impact come out of. And so when you start to critique them, it can be complicated for teams to understand that, much less be willing to think about how to alter their work. It gets a little easier to get them to think about how to make things more scalable in the future when you can tell them how to think that way, right? So when I talked to CRS, I was like, oh, we should have started with mindset shift, but I don't even know what that means. Like, I don't know how we would have done that. Like, the only way that I knew how to do this work was to figure out how to do the technical work first. And I believed that it would be a meritocracy and people would see the value of the work and that they would sort of come along. But and to an extent they have, key people have. And that's, at the end of the day, maybe that's what you need is champions. And I feel like it's been a long process, but over the course of 3 years, I really do feel like we've now got strategically placed champions in specific country offices, in specific regions, in specific leadership roles, in specific other departments. And so maybe it's not, maybe it sort of fills in slowly from there, because if those champions are able to, shift the way that they do their work to keep the principles, mindsets, and ethos of scale in mind, then that becomes the standardized practice of the organization over time. But which is not a very clean answer, but it's the experiential one.
Well, actually, since I think that's a great place to close, Anita and Caitlin, and thank you both, and thank you, your colleagues, both from IDinsight and also Emily and Joshua, who are not with us anymore. If I can just highlight the last point, I think we need to look at mainstreaming scaling within an organization as a form of scaling itself, and except that we're doing it internally and sort of externally. And in the most traditional dissemination of of new technologies, you have early adopters, you have who are all gung ho, yeah, this is great, all this. Then they're the ones, oh, look what they're doing, yeah, yeah, yeah. And then there are the other end of the spectrum who are like, not over my dead body. And they're the ones in the middle who are going to wait and see how it goes. And especially since we live in a time period where there's a lot of new stuff coming, well, not so new anymore, but a lot of other cross-cutting, what are perceived as cross-cutting issues, gender, climate change, youth employment, etc. A lot of people are going to like roll their eyes, oh my God, now just another one of these things. But I think, as the evidence accumulates, and hopefully, our colleagues have been putting in the chat that, USAID is starting to look more at cost effectiveness, whether they will look at cost effectiveness relative to unit costs as compared to sustainable payers. One can hope that maybe based on this conversation that will start to be a criteria for projects. Not only was this cost effective, is this something that other people could afford to scale, would be a great question. But I think this question of early adopters internally, champions, that's exactly the approach one of the other case studies is taking, the CGIAR, which is they're taking a voluntaristic approach, but they're putting resources and incentives behind that, so that there's a fund for scaling. And I think we'll leave it with that. So look, thank you all very much. Thank you, CARE, for the cutting edge work that you've been doing, for being willing to partner with the CGIAR on this case, and the whole mainstreaming initiative. And thanks to IDinsight for the work that you've been doing and supporting them, and for providing high quality evidence support around the world. Really appreciate your time this morning, Will, and the work you've been doing. And we should be having some more mainstreaming cases in the fall, since people tend to be gone over the summer. Then we might squeeze one more in June, but I can't confirm it. Let me just say that the mainstreaming scaling work, which there are a dozen case studies now on the Scaling Community of Practice website, and in the next few days you should see a synthesis paper, will be continuing for a second year. And we hope to have at least another 5 or 10 case studies, as well as thanks hopefully to some particular funding from one donor, a focus on the health sector. So I really appreciate you guys, and I wish everybody a great summer. and see you in the fall, if not before. All right, thanks everybody.
Thanks all.